Everything must be designed around how do we expand our ability to impact patients with health opportunity, with diagnostic, okay? Awareness. That's the deal. Now, this is going to break down into what we call the buckets. For our DST universe, you understand. The buckets or streams of production mean diagnostic creation comes from new patients, from specialty tracks, from hygiene, from reactivation. For our specialists, we have opportunity streams from sources of referring doctors, from existing patient referrals, from the ability to expand cases, lots of stuff. Okay. The next piece of this deal I want to talk about very quickly is how do we promised you this thing about how to design a nurturing patient experience, okay, to increase value. So here's how it works. We're going to focus on four key elements. The first key element is what I call before the pre. What pre-work are we doing with the patient? Think of Stephen Covey, begin with the end in mind. Patient walks in, patient, here's what we're going to do today. Okay. Before the patient walked in, video, patient, here's what to expect. Also packed in with pre is going to be reaffirming their decisions, rewarding positive behavior. So we don't say, patient, today we're going to look at that tooth that's hurting you. We say, patient, so happy you're here. It's a great decision. Today we're going to do an assessment of your overall health. Now we realize you came in with this particular problem. Okay, tooth, we're going to certainly take a look at that as a initial first step. From there, we're going to expand out and we're going to develop a long-term plan for your overall health based on our four pillars: your gums, your teeth, your bite, and your smile. So throughout the day, it's going to be a discovery and you're going to learn a whole lot. And this way you can be eyes wide open, empowered with knowledge for you and our doctor to make a great decision about what we're going to do to help you. Did you see that? If you take what I just said in the last 30 seconds and you do that with every patient, and there's also a version for existing patient, you literally just transform your practice because we transform the patient's perspective, their mindset, and their expectations. Okay. The second part is inside of the diagnostics, right? Inside of, case building, inside of the clinical experience. Now, the clinical experience, here's what I want you to think of for this. I want you to think of taking the patient's health and assessing it on a scale from 1 to 10. So gum health, 1 to 10. Dentition, 1 to 10. Bite and occlusion, 1 to 10. It could be aesthetics, 1 to 10. Don't miss aesthetic health, whatever it is. All right. And then you close the gap. You go from wherever they are to a 10. And you say to the patient, well, here's how we can get you to a 10. And we tell them, patient, scale from 1 to 10. Where do you feel your smile is at today in your mind? Now, one person is going to say a 10. And when they say a 7 or an 8 or even a 9, we say, that's fantastic. It's pretty good. Let me ask you, what would a 10 be like for you? Okay, it's very simple. This is the way the patient self-diagnoses and we get case expansion, vision expansion. All right. You'll blow your diagnosis to the roof in this way. You can incorporate photographs, scans, etc. Now, the next part is how we get case acceptance and prepay. Now, the secret to this is present the whole plan. Do not break down the visits. Most of you know this because you've been here with me for a very long time. So, but this has to be meticulously managed. If you don't know how it's being presented or your treatment plans still have visits on them, if we're not mastering getting the money to flow in advance, then you cannot achieve the creation side, which is the origin of it all, formula. So you will forever be beating your head against the wall. You'll forever be having roller coaster ride. You'll have good months, bad months, ups and downs. And the reason is because you will remain dependent upon production, which is a scheduling dynamic discussion. Okay. So the next and last part here is the post. So pre and post. So this is not just about follow up, but this is about conversion. So we must make sure that we have a post experience. That's everything from appreciation to surprises to closing the case and getting money to referrals, reviews, testimonials.